All right, I am going to call this meeting to order. I thank you all very much for coming in on a sunny day, and for those who are remote, welcome. I see two on.
Oh, Joe did just.
We're still waiting for Joe and.
Yeah, screens. I guess my screen's a little bit behind because Joe is.
Okay.
My screen.
And Representative Kraft will not be here today as she's on vacation. So other than that, we're all here. So thank you for this sunny day and coming in. It's hard for me to leave on a sunny day. All right, so I ask you for the purpose of this, remember, this is a public meeting and therefore the public is viewing this, and sometimes they can't hear us, so please speak up and please identify yourself so that they know who's speaking on this event. All right, so minutes, the first item on the agenda is the minutes. I hope you've had a chance to review and we're looking to review those minutes, and if it's the council pleasure, we will vote on the July 13th, 2023 minutes.
I'm sorry, I can't, the participants can't, the panelists can't use their videos for some reason, but I figure out why.
For voting for participants who are participating remotely, members who are participating remotely, they have to be able to be seen and heard to be counted for voting. Haley's trying to work out some technical issues.
Okay.
If you want to move on to, part of the agenda that doesn't require voting, possibly, we could have it.
We can do that.
Haley can work on it in the meantime.
All right. Because right now we can't see Eric or Joe. So, all right, so we will move that item and go to item number 3, which is a brief recap of the governor's opiate summit on July 20th. And for those, I think almost all of us were there, which was spectacular. And those who weren't, other council members picked up and introduced you to the participants at the summit. And so I think it was well received, but I just want to know if you all had some feedback for that or had any comments on the summit. Oh,
Paul Vinsel. I just find it very motivating every time I go to see that many people involved with substance use disorder and treatment at the same table and all speaking the same language. It's one of the few places where I can go and talk about what I do and people don't roll their eyes.
they get it.
Yeah, they get it.
Yeah.
Yeah.
Yeah, it is a, it's funny, the first summit that the governor had, I remember it was like going home. That's all I can describe it. It was like you're with people that are like you, people that do the same work that you do, sometimes on different levels. And it's always been from even when it was remote, it was a good experience. Any others wish to comment?
I'll just
Hi, Bruce.
I often wonder I wondered the same after last year's event, how many projects were born that day and how many relationships were born that day that are going to last for years and years. And it's always wonderful. It was amazing last year because we'd all been on Zoom for so many years. And I thought maybe that shine would have been, kind of dull, but it was the same thing this year, getting to see and talk to all of those folks that we see on Zoom week after week and month after month. But there were conversations that were happening about best practices and things that were not included in the actual workshops but folks were getting together and planning things for the future. And I know that was true in my case, but it was happening in other spaces as well. So I will never be able to track all of those conversations and all of those projects, but a lot was born that day. I'm certain.
It would be interesting to ask people after attending the conference, if you met with people afterwards and was there ideas that were developed or sprung out of that. It's hard because again, I'm sure there were relationships that were cemented. And I know for me, when I was there, I connected with people that I had worked with 35 years ago and reconnected and figured out where we were doing what we're doing. So, maybe we should just add care there, maybe some way. I can slip a little
I
note to
know,
add
I
care.
know that after one of the workshops that we were at, the meeting after the workshop
Mhm.
that was taking place out in the hall, which happens often with some of the better meetings you can go to.
Yeah.
We didn't want to go back. I mean, I don't know how we almost didn't make it back in time for the rest of the summit, because we were really engaged in some really important conversations that maybe we should have had before,
Mhm.
but this was a forum for us to do that.
It'll be interesting. It's a good comment. Thank you, Bruce. Gordon.
Gordon Smith. I appreciate all of you who came and many of you organized breakout sessions. Liz was and staff was involved in one, Courtney helped with the youth one. And I thought it was really impressive for our own breakout session when 12 of the 15 of us were there, and it showed real people. And that session's recorded, as is the Jackson Library and all the plenary sessions. So it does live on. It's very easy for me. It's available on the AdCare website. People don't have to register for the conference to get access to that entire session. And I don't have time during the day to actually, people tell me that, for instance, to listen to the content. So people tell me that Carlton Hall was a great opening for prevention. So I really want to myself sit down when I've got time and watch his talk. Just one so that it all lives on. Secondly, the ability to do that with our federal partners down in the front row, people like Dr. Olson, who's the director of Center for Substance Abuse Treatment within one of the divisions of SAMHSA, all our Region 1 partners. Those things really matter. They really do. And that Dr. Olson was there from 8 a.m. to 5 p.m. despite her role being a strict 30 minutes in the afternoon. Those things matter to me. She didn't just breeze in there, and then so anyway, I agree with everything you're saying, and we'll, likely we'll be able to have 3 more, and because I think they may make a difference. It's not just a one-off event. It's something we use all year long, and we'll be starting up the monthly webinars again in September, on September 1st. So thanks.
Well, thank you.
Can I ask, raise one point? Gordon, just to follow up on that, Brendan O'Neill with the Attorney General's office. Dr. Olson's presentation, she mentioned there, SAMHSA's database of evidence-based work or programs or something to that effect. I'm not characterizing it clearly, but we, in our resources page on our website, we link to that database as a source of information for evidence-based programs. In the little bit that I've kind of, as a layperson, looked at it, for me, I found it a little bit hard to navigate or follow. And I wonder, so sort of I'm asking this group, if there's a, if there's a, another resource that I could add, to our resources page that would be helpful to folks trying to put the program together on the ground. I'd be interested to get that information.
Yeah, can I just mention Liz Blackwell-Moore, Cumberland County Public Health Department. I'll say that I think partly, prevention is something that is very local, and I think there are evidence-based practices, but many of those are really big picture, and then how they show up and how they happen on the ground are really very specialized and localized. And I think that the Maine Prevention Network structure for prevention is really still in development. It's happened in January. So the way the state is funding prevention programs across the state and what people can do looks a little different than it did for the previous 7 years, and then the previous 15, 10 before that. So it's in a new iteration. And so I think that when we have more, when that group of Maine Prevention Network partners has information that can link directly, it would be great. Because I will say that the one thing I was a little disappointed, I think we could use more local prevention people saying what they do, because there's the science of prevention, and I think, but what does that look like? How does that happen? How can people be a part of it? I think the breakouts showed that, but I'm not sure in the plenary, there was like a lot of people getting that information about like, okay, what's evidence-based practice for me in my community, and what does that look like, and who do I connect to? So continuing that conversation with a larger group of folks who are super committed to this, I think would be awesome.
Sorry, totally unrelated. Miles Willett is trying to get in feverishly.
Oh.
That was my update.
Yeah.
Did he?
Oh, Miles.
He says he needs a password and, yeah, he's just.
Pass,
We'll work.
Kina, Joe, Eric, it didn't ask any of you guys for
Oh,
password.
so you know-
did it?
You know what he's
No, and
doing?
I just emailed Miles.
I'll get in touch with Miles.
Okay, because he's
Yeah.
probably just going in with Zoom and he's not using the link.
Well, that shouldn't have a
Actually.
password either, because the public has to be able to get in.
So,
All
Eric,
right,
Right, I just emailed him the link, Pat,
Eric,
so
do
you
you want
know.
to say something?
Eric,
We don't have any way to,
Yeah.
we don't have any way to hear
no,
it.
we do, it just comes.
Okay, hold on 1 second, Eric.
We had to last minute change it because that one was not. Will you try talking, Eric?
Yeah, can
Eric,
you hear
can you
me?
say something?
Yeah, I'm talking. Can you hear me?
No, we can't hear him.
Do you have the sound going to the?
Eric, can you hear me, Eric? I
The
can hear
sound
you.
won't go into
I
the
can hear you
actual
just fine,
episode,
Joe.
Okay, great.
So it's supposed to come on my laptop and it should be loud enough. Oh, that's unpromising. Will you try speaking again, Eric?
Eric, can you say something?
Yeah, can you?
Wow,
We can hear you now.
nice job.
Sorry.
I noticed Miles wasn't on and I emailed him the proper link, so hopefully that helped.
Okay,
Cool, thank you.
did you have anything that you wanted to add about the conference?
No, I thought it was great. I just echo what was already said. Nice to see so many people there, and I think the conversations, like Bruce said, in the hall were as important as the ones inside the auditorium. I saw a lot of my law enforcement partners there, which was nice, and that's real important to me personally, that our profession is trying to do things to reduce stigma and become, recovery ready departments. So it was just good to see those conversations taking place, but thank you.
Thank you. All right, well, there's no other further discussion. Thank you very much for your input with that. And we're still waiting for Miles. So what I'm going to do is skip down to item 4. So item 4 is in regards to the remote meeting policy.
Well, members of the public are gonna try to comment through Zoom. We're still,
Oh, we can't do that yet.
I don't think so.
Okay, never mind. We can't do that.
Okay,
Can the public comment at this point?
through Zoom.
Yeah.
But the members can't.
Everybody can now.
Everyone get.
Oh, okay, all right, yeah, it's Miles, right, got it.
Yeah, Miles is.
Miles is just, he's in the county, so.
Yeah, who knows what's going on.
I don't know, it's just a county.
We have-
Good thing I'm here. Sorry, Miles.
Yeah, no, anyone who wants to talk.
Get
yeah,
beat up.
I just-
No, I love the county. I never understood that. All right, so we're going to go to the part of the meeting where we talk about the remote meeting policy. So one of the things that, although our meetings are always public and we always welcome public comment, either through emails or at some point in time, we're going to talk about how do we get more public input. For the purpose of this public meeting, we will take public comment on the revised remote meeting policy only. And so I know that the public has lots of information that we need to hear and want to hear, but with the purpose of opening this public meeting, it is to comment on the revised remote meeting policy, which is for people who don't have it in front of them or here, it's on our website. So the public was able to see it before today. So I am going to, do I need a vote to order a public meeting, or I could just say?
Open public hearing.
I am opening the public hearing to discuss the remote meeting policy, and at this point, we will take public comment.
You should probably, I mean.
And
ask
people
them
from the
If
audience
they
are
want
also
to,
welcome.
want them to use the hand raise emoji or,
It would be helpful if they,
because they're gonna have to let me know they want to.
okay, so they're gonna have to use the raised hand
Yeah,
Yeah.
function.
function.
Sorry, I'm also trying to get Miles on.
And also, anybody who was attendance today, if they want to comment, they're welcome to comment, and we will, for the sake of timing for the meeting, you're allowed 3 minutes. Which is, Courtney knows, if you spend any time in the legislature, you get really good at talking fast in 3 minutes.
You do.
You can get a lot said in 3 minutes. Is there anybody? All right. Okay, so if there's no public comment, I will close that section of it. I will close the public meeting and then open the discussion on the remote meeting policy to the members of the council. Any questions, concerns, deletions, additions to the policy that's in front of you?
Saying then I move the policy as it's written, as
Second.
presented.
Gordon moves it, Courtney seconds,
To do a roll call.
and I'm gonna have to do a roll call because people are online. Is there any public comment? Paul?
Just a question, if we, I read it yesterday, but I don't remember every detail. If we need to do it remotely, do we do what we did this time, just send an email to Haley with the link?
Mhm.
I'm probably gonna make a habit of just extending a panelist invite to everyone so that we don't have to do that actually in the future. So if you use it, you can use it, and if you don't, it'll just.
Haley, I don't know the technology of the state government, but is it possible to just send out a calendar invite to everybody that's on this council with the link for the panelists?
What do you mean calendar invite?
Like I use Google Calendar. I don't know if the state has
Google
that.
Calendar, I've never used Google Calendar, so I'm not sure. I use Microsoft, so the Outlook.
Yeah, there's probably a version of that.
Yeah, so
Okay,
in
yeah.
Google Calendar, you actually can know if you're attending, if you're going to attend remotely. So we can actually keep track of it, and the link is.
If I send it to your email, will it go to your Google Calendar?
Like you-
No.
I think-
No, it has to be a calendar
Yeah,
invite.
if you send like
Oh.
an Outlook, right, other people, like even, like,
I mean, I have to send a Zoom panelist invite though, not through Outlook. But I will try to figure out how to.
Yeah, we'll look into it.
Yeah,
I think
Okay.
you can still do that from Outlook and everyone will still get it.
Yeah,
I have to do it from Zoom to make you panelists though. I can't send it from
Oh.
Outlook and make you panelists.
but at least if you did it that way, you'd know who's attending in person and who's attending remotely, and then you could just send it on.
Yeah, I'm just
Save
gonna
yourself
send out
some
to
work.
everyone though, so everyone always has the option every meeting. Especially as it gets snowier.
As it gets snowier, it said was coming, not anymore.
and this might be, Haley, as long as we're talking about, do you want to talk about, we're in this room, right? Or you've scheduled the next,
Yeah, so I scheduled this room till November 2024, from 2 to 4, well, from 1:30 to 4, so that we can set up from every day except for October. Which is a different day. Tuesday, I think it's Tuesday at the same time.
Of this October 2020.
This
Yeah,
October, it's
yeah, so
Tuesday.
the only difference is that the meeting that would be on the 14th of October, will be on 10/10 that Tuesday. From the same time, 2 to 4. But other than that, that is our new consistent meeting time.
There is a motion on the floor in a second. Any further discussion on the policy? So Haley is going to call a roll. All those that are on the Zoom have to be visible, and we have to hear your vote. So I guess Miles still isn't visible. So, but we have a quorum And he can,
Sorry, I'm trying to get Miles on. Did we
Okay.
vote?
no, we're gonna vote now. Take a vote,
You want me to do the roll call?
please.
Okay, Liz Blackwell Moore,
Yes.
Todd Brackett.
Yes.
Joe Everett,
Yes.
Betsy Fitzgerald,
Yes.
Courtney Carey Allen,
Yes.
Pat Kimball,
Yes,
Ben Mann,
Yes.
Bruce Nodden,
Yes.
Miles Alette, just kidding.
wait a minute, is that
Eric
Miles?
Small.
There's Miles. Oh, we see him.
I'm working on him right
Okay.
now. Eric,
Yes.
Gordon Smith,
Yes.
Keena Thacker,
Yes.
Chastity Toole,
Yes.
Paul Vinsel,
Yes.
right, 13 yeas.
All right, motion carries. I thank you very much. We have a remote policy in place. Excellent. Let's bring on the snow. Let's not. All right. So we still don't have Miles on here.
I just need to send him a link, sorry.
Okay.
And then,
All right, so let's move on to the discussion in regards to the Department of Health and Human Services and presentation. If you remember at our last meeting, we received as part of the follow-up from the department. One of the slides was their priority areas where they thought the councils could help. And some of the funding could go to, and it was their 6 suggestions. So as I went home and I had a conversation, I think, with Brendan, we actually talked about, we really never got to discuss these priority areas for the department. And the reason I thought it was important for us to have this discussion was, is there anything that this council really is interested in helping fund? And if so, what do we need for details from the department in order to explore the possibility of doing that? And the reason for me, and just me, and I'll take input from the council certainly, is the department has all they need to put things in place except the funding. So for instance, with other programs, outside programs, we don't have contracting set up, we don't have a means to pay them, we don't have all that. When we look at the department, they have all that means set up. So if we give them funding under our guidelines saying what we need, they can immediately, almost immediately, put those funds to use. And we've heard from the public over and over again, what are you going to do? What are you going to do with the funding? Now, on these 6 priorities that they've listed, we may not have any interest in funding those. We may not have any interest in exploring it further. But I think that I listened, when I did, I heard a lot of, there was a couple questions in regards to expanding the crisis receiving centers. I heard discussion on bed expansion. I heard some discussion on corrections and medication assisted treatment within the jail. So there seemed to be some interest from the members of the council. So I thought I'd give you the opportunity to look at these one more time and say, is there something the council has some interest in bringing the department back and say, and asking them more detailed questions? If we gave you the $500,000 to do the anti-stigma campaign through Shatterproof, what would that look like? And how could we partner up? But again, it's funding that we could easily dispense and people would immediately be getting services, or at least that process. So that's just my thoughts, and I'm just interested to hear from the rest of the council.
One of the details I'd want to get after the finance committee is what of these, the money that they're stating here would be a one-time spending, and what would be ongoing spending? Because all of these look to be really beneficial for our community.
I mean, the only one that I can think of that sort of addresses that, they did say in the first one, expansions of the crisis receiving centers. They did ask for $500,000 startup and then 2.5 million in operational. But again, how long will that and what will that be like? And to expand that, to make sure they're sustainable, because that's what we want to do, is have sustainable programs. Courtney, and then
I was just wondering if anyone had a copy of those couple slides.
Yeah.
We can share.
I didn't bring mine. Pull them up.
I had a nice
Oh,
little
thank you.
notes on mine and didn't do that, sorry. Thank you. Ben can go and I'll raise my hand again.
I was gonna, just respond from my perspective to Paul's question. I think just looking at the list, which I have on my computer. I think the naloxone and the anti-stigma campaign, it could be one time if we chose to, as opposed to, for example, expansion of the crisis receiving center. That would be, I think, would be an ongoing commitment that the Recovery Council would be making on a year-over-year basis. Otherwise, we'd be standing something up that would, like, possibly having to close it back down if the funding was cut off. It's not the case for naloxone distribution or a media campaign. You know, I think ideally ongoing commitments would be beneficial, and I'm sure we could put both of those to use, but they're not, it's not the same category as like a service delivery, like receiving centers or MOUD mobile units or something like that.
yeah, and I think Commissioner Squirrel said, or she's not Commissioner, Director Squirrel said that part of her thing in the crisis receiving centers, if I got it right, was the intent of that it is a main care reimbursable piece, but we all know can't live on main care dollars alone. So that would be how much that would go in there. And I do know, I will share with you that Shatterproof has approached me as the chair of this council, as to coming here and showing you their programs, their prevention program, and the evidence base they have and the other states they've worked with and what has gone on. But they asked if they could do a presentation here, and I said, that's not up to me, that's up to the council. So when I saw that the director had that on her list, I thought that was interesting, but I actually sat through a presentation I found it very interesting.
I'd just like to also address the fact that, so there's the 6 priorities on priority area 1, but then there's also priority area 2, which has 2 additional that are on the expansion of prevention activities. So it's actually 8
Oh,
that
okay.
they identified. And you can see there's 2 million for the Maine Prevention Network.
Yep.
And I think my assumption from this is that that would be ongoing, not one-time funds. And then the pilot and then the ongoing for the ESPER.
Thank you.
Miles has a stand up.
Miles, and then Gordon.
Good afternoon, folks. Miles Willett. Thank you for being patient with me on logging on. I don't have the information in front of me, but our medication assisted withdrawal beds or inpatient rehabilitation beds on that list of the state's priorities or states?
Yes.
Yes.
Yes, they are.
It is. And how much are they asking for that? And is there a specific, I'd be interested in learning more about that. I feel like that's one of the biggest gaps that we have here in the state of Maine. Every single day, I work with folks every single day that are looking to get into an inpatient rehab or need a detox, and we just don't have it. There's wait lists for months. And that's life or death for these people. I understand the media campaigns and the naloxone distribution and things like that, but really seeing a huge need for detox beds and inpatient rehabs. That way, when folks are ready for treatment or ready for help and they ask for help, there's something available, because 2-3 months go by and and their minds change immediately. So I'd be really interested to learn more about that from the state. I know that that Gordon and Sarah had given us a list of stuff that's opening up around the area. I'm not 100% sure how accurate those are, like the list versus the reality of what's available and what's open and when. I don't want to, get into like a battle about it, but I mean, I make these phone calls and write these referrals every single day. And to me, that's where I'd like to learn more, and that's where I'd like to see a good portion of this money being spent. But that's just my thought.
Well, let me respond. Gordon Smith. We gave you the list, I think, that shows the 140 beds. They're not open, Miles. We didn't suggest that they are. These are things that are in the pipeline. Actually, the adolescent girls facility for day one is opening this month. And some there are some of the beds in Portland that are open, but we can tell you our best estimate of when each facility it goes to different fees. It says the contract been signed, was the award granted, was the contract signed, and when will the facility be constructed, renovated, open? It takes a long time, unfortunately. But we have all that information. So, and so you want to know we've had 3 different RFPs, as you know, and the third one, the awardees were just informed maybe 2 weeks ago, Ben, would you say? So that was, they funded 4 of 9 projects. So we need to bring you up to date on we can tell you where they are and what the amount of money that there shouldn't be. What is the need? Well, you can look at waiting lists. We love to think that we've got enough 40. The legislature also $2 million for 10. We have to take that into consideration. That's my summary. Another one-time on mobile methadone time expense because of increase now largely operational and for cost right now at $1,000. So one-time things, then things that relative to keep is the case, I'm afraid, with the receiving centers because cost of sustainable business model that keep those doors.
In a second.
Oh, yeah, thanks. This is Tina Becker question, but I was.
Sorry.
Only hearing like blurbs.
No worries.
Okay, give it a go now. I think it was just Matt.
Okay, try it now.
Okay. Yeah, this is Kina. I think Gordon actually answered part of my question because I was interested in learning more about the mobile methadone units. As an inpatient infectious disease and addiction medicine doc, I think we're seeing a lot of folks transitioning outside of the hospital and who are interested in being on methadone, especially in the era of fentanyl, where methadone can be so helpful. But the wait list, I think, as everyone knows, is super long. And the folks that I'm seeing on the outpatient side oftentimes can't make it to their methadone clinic appointments, transportation, financial barriers. So I think prioritizing these mobile units will be wonderful. And in the era also of polysubstance use, hopefully there can be some harm reduction work, on these mobile units. But Gordon, I think you sort of answered the question in that most of the stuff would be a one-time cost, though I expect there will be some ongoing costs for maintenance and staff and that kind of thing, but.
Liz and then Gordon again.
I guess I'd love to just go to this part around process, and just sort of where do we go from here? Because it sounds like there are some things the state really would like to spend money on that perhaps we all think are all important things as well. And also we haven't had the program committee meet yet to talk about what's the process for soliciting or figuring out what to do. So I wonder if there's a parallel track that could be happening where the state is asked, yes, please go forth with coming up with what's more information, what's one time, what's long term, to give us that information while we also parallel track figuring out how we want to gather some more information. I think this money offers this really interesting thing of can be used as like filling infrastructure needs, but also can be used as innovative funding for things that the community says but we need this, and it might be harder to move that through the wheels of through this funding source, and we want to do that. So, and there'll also be the opportunity for us to hear from what our counties and towns spending their money on that may also meet some of those needs. So I guess I would suggest with your question, we could talk about what we all think, and in some ways it almost doesn't matter in this moment because we don't have a process yet through the program committee. So I wonder if we can, if there could be some agreement that yes, please ask them the questions, and that go to the program committee as it's figuring out how it's the process for coming up with spending.
Yeah, that was, and you said it very well, but that was my thought process. My thought process was, we have to meet, we have to determine what this council sees in our process and how we do that. Again, particularly around where the need is, and the next subject you'll notice is more about data collection, about discovering our own priorities and how we do that. But again, I apologize if that was my intent. I never thought this would be the one time. I always thought that would be exactly what it is a parallel process. But again, this was, again, going through the state and asking questions and finding out whether this met our needs as a council. We know that a lot of the things that we haven't solved are solved by them. They've already RFP'd. They've already done some of that work that we will have to do on up and coming programs. And again, when I saw the interest of some of the people on the council, I thought, should we be exploring this further? And it's not mine to determine that. It's up to the council to say they want more information on these 8 priorities that they have really given us. So, Gordon?
Yeah, I wanted to first
Thank you.
respond to Dr. Thacker on the methadone, because there is the new methadone clinic in Manchester is seeing its first patients on Monday. So there are not necessarily waiting lists at all of the 13, soon to be 14 existing opioid treatment programs, OTPs. We might call them methadone clinics. There is another new one opening up in Rumford in October. So these are very promising developments, because that means there'll be 3 new clinics since 2019, and we hadn't seen a new one in 8 years, and we've lost 1. So I still think the mobile is still going to be necessary, because it's not just about opening up. Transportation's a huge issue, as you said. It's a lot to think about there, but I just wanted you to know that we also look at those numbers every month, and there's been almost a month-to-month increase in the number of clients of the OTPs every month for like the last 48 months. And to the point where there's just about 5,000 individuals each day on methadone. So your comment that we're seeing more people, perhaps because of fentanyl, moving to that option is, I would say, accurate. I think on Liz's point, my thought would be that if there are some easy wins, urgent things that are not difficult to do, because we haven't even had a discussion with Ben and others yet, and Brendan, about procurement. We could say, yeah, we could vote today to give $2 million to X. And based upon state law, procurement, contracts, it could be a year before you see that come to fruition. So I think because of we're on public record, so I can't say it any differently. I don't think any of us want to be here in November with the first anniversary date of receiving the $14 million and say that we haven't spent any money. I think there could be 2 parallel paths, just as you said. There could be get some money out the door for some urgent things that aren't difficult to accomplish. And where there's a sure need, the stigma reduction could, and these are not, don't take up large chunks of the $14 million. I said the mobile methadone is 600, less than $600,000. The shatterproof project, when we last scoped it, was like $600,000. So, and at the same time, absolutely, the grant committee needs to get started. And I'm sure we'll talk about that today, about how we do that. But, and if we could even say that, well, we wouldn't want to see more than, X millions of dollars in phase one, because we wanted to keep at least this much in phase two. And then Brendan will tell us when in the current year, we will start to see checks in the account for 2023. So, we've got now some essential things done. Brendan's got the conflict of interest policy, draft policy done. We want to give people hope that we are getting there, and that we will be able to get money out the door to help the people it was designed to help in the very near future. I think we all feel that sense of urgency. Thank you.
That's good. Courtney and then Paul.
So I also feel this sense of urgency. And there are definitely things on this list that I would be inclined to support. I'm actually going to hold back saying what those things are. And the reason why I've decided to do that is because for me, I think it's very important that we get information, that I have all the information in front of me. While $14 million feels like a lot of money to me as an individual, $14 million is not actually that much money and compared to the need that our communities are seeing. And I'm struggling to make decisions that could be 18 years long for a crisis receiving center in this moment without more information. I feel very committed to hearing from the folks that are like, this is what we need. And the state's asks being within those asks. And I can't believe I'm the one that's like, no, actually, we need more process, because I am the exact opposite of that type of human being. I know our friends and our family and our community members are dying and they can't find beds and they need things and all that. But I just think that the decisions that we make in these early moments are going to be some of the most impactful decisions about this money for the foreseeable future. And I don't feel like I have enough information to make those decisions yet. I need to know how much the yearly budget is, how much all of this is. I need to hear from the program committee, etc.
Thank you, Courtney. Well,
My question's easy.
I like these things.
Gordon, this number 4, the expanded residential medically supervised withdrawal beds in underserved regions. Is that for those 140 new beds, or is that for more beds over the 140 new beds?
Well, it's really more.
Okay.
We've already got the financial commitments and the money set aside for what we've committed on the 140. And that doesn't include what the legislature did for those 10 additional beds. So this really is more, because I don't think any of us feel like that's enough, but I'm afraid when you look for really hard data on waiting lists or prevalence. I had a breakfast meeting this morning, the person really impressed me. Prevalence, how many people are starting, how many people are waiting and have made a commitment to recovery. We don't. The only solid number we have in Maine in terms of prevalence is really looking at our syringe service programs, because that gives us a hard number each day of how many people in Maine are using drugs that they would require the services of a syringe program. And that's about 7,000 people today. But how many of those are on a pathway, or when might they commit to wanting to get into a supervised withdrawal? If that kind of data is available in the state of Maine, I wish somebody would give it to me, because I don't have it.
Could I ask a follow-up? I'm sorry.
Done.
Just,
Edmund?
help me understand the difference, but you made a comment about, from your breakfast meeting, about, committed to recovery. and help me understand the difference between someone who's committed to, committed to recovery and somebody who's in crisis, withdrawing, needs stabilization. Right? So to me, there's a difference. That person may or may not be committed to recovery, as we know, once they come done withdrawing and stabilize, however that's done. So I'm just trying to understand the difference between some of these beds. Are all these beds long-term recovery beds? Are there some, withdrawal stabilization beds available? Or will there be? I'm sorry.
No, Gordon Smith in response, and I'm glad that the last question you asked, I can answer as a lawyer and a non-clinical person. The questions you've asked about what phase of use people are in and what their needs might be at any point in time, I'm going to refer to the two physicians on the panel or other experts that are here with us, because I think that's really complicated. The beds are generally, we know which they are a mix of beds for medically supervised withdrawal, which we might have formerly called detox, because that's seen as an acute need. That's generally a period of time, 5 to 7 days. Not everybody needs a residential program like that, but many people do, and it's been a real gap in our system. We lost beds during the pandemic and all that, so there's been a real need. Almost all the projects have a piece of that, and then the rest is mostly what I would call long-term residential. Chair Pat is actually an expert in the residential piece because she ran an organization that had residential treatment care. So I can tell you from as a layperson that, we're way beyond the 28-day programs. There are actually maybe 2 that still exist in Maine, but mostly we're looking at 30 days, 3 months, 6 months, a year. Macaulay houses keep people until they're ready to then be transitioned to hopefully a really good quality recovery residence of some type. So it's mostly what I say, a mix of detox beds and residential care beds. And you can build them, but we still have to find a workforce to work in them as well. So that's all part of the mix.
And if I can try to answer you as a former clinician, I'm no longer a clinician, and as someone who worked residential. So if we sometimes label things as somebody's ready, the point of contact of any person reaching out for help, we should be helping them without sometimes being concerned about long range where they are. If I was somebody having a heart attack, I wouldn't go in the ER and someone say, well, you committed to, open heart surgery. They wouldn't say that. They'd treat my symptoms. They'd treat that I wasn't feeling well, that I needed to get, on medication, and they'd do whatever. So when we look at people with substance use disorders, we should be looking at it that same way, as this person needs immediate help to relieve pain or discomfort or whatever that is. And in that process, sometimes people say, I want more. And other people say, thank you very much for caring for me, and move on. And so we have to sort of look at individuals who have a substance use disorder as in a need. And sometimes they are at different levels of where they are in their care. And but we have to honor every stage of that, in the fact that they're human beings and they're uncomfortable and they're reaching out. And wait lists in the same, I have been retired for years, and before I left, wait lists are the most horrible thing for a residential treatment center to have. We have people dying on that wait list, parents calling to say, take my child off your wait list. They're no longer living. Those are horrible things. And so, one of the things to do is how do we, and I always hear this thing, no closed door, let's have all these open doors. That would be ideal. And maybe we'll get there someday, and hopefully will. But again, it's really hard to say who's committed to treatment and not committed to treatment. How I look at it is, we should be committed to helping. When everybody reaches out and says, I need help, we should be able to say, okay, what is it that you need? Is it a physical piece of detox? Is it something more? Let's help you. Let me tell you what's available, but that's just from my perspective. Courtney?
I do actually have a couple of questions for the state if they are gonna come before us. I would like to know where their target communities for crisis receiving centers would be. Also, I would like to know pretty much the same question, now that they see the landscape of the 140 beds, 140 beds plus what the legislature gave them, where would their target locations be for medically supervised withdrawal beds? And a little more information on the MOUD units statewide. And I also, Pat, earlier, I don't think anyone's actually touched on this. You've asked about this stigma campaign folks. Shatterproof. While I like Shatterproof is a wonderful, phenomenal organization. I do not think it is appropriate for this council to bring forward a particular nonprofit organization to give us a presentation when we haven't given that opportunity to anyone else.
Thank you. So if I'm hearing right, and please, I'm not gonna take a formal vote, but if you just speak up. So you're interested in hearing more about these 8 programs. I hear Courtney's specific questions. I hear things about wanting to know a budget. What does that budget look like? I hear about sustainability. So would you like the state to come back with more detail in regards to these 8 programs? And would it be possible if all of you could submit your questions to me in regards to these programs to make sure they're able to answer them when they come?
I guess I'm like, I can see that there's value in all of these.
Mm-hmm.
And I'm also struggling with this process thing. Like, I feel like there was a slowdown was said to us all, we need to make our process and we're gonna have this grants and programs committee. And now it feels like there's a little speed up and just fund these things. And so I guess I know that might not be what you mean to do. It's how I'm feeling about this right now. And so I am like down with these things. I'm not trying to say I'm not down with these, but it feels like if they come back, we get back on this, like, we all are focused on these 8 things and not on the process by which we're going to fund them. Because even if they come back, are we all then going to vote and say, yes, let's fund that one? Yes, let's fund. I guess I'm asking about process, because if that's not what's going to happen, what I guess I would propose is that we have them get ready to be a part of applying. Like, yes, answer these questions or whatever we want, the questions we have for them, but like, yes, get ready to like, be ready to apply to the grants and programs committee as the grants and programs committee figures out what that application process looks like, and then can bring it to the full council for some sort of review.
So my concern with that, Liz, and again, that's not as chair, it's a member, just a member of the council. My concern is then look at probably mid-spring to fund any programs. The problem is the process. We have no process of we don't know what our funding looks like. We don't know how to distribute the money. We don't have contracts developed. We don't have an RFP process developed.
But they have all of that.
They do.
Right. And so I guess I'm saying they can prepare and do that and tell us in the grants and programs committee in September, October, and we can then, as that committee can decide, here's our process. We're gonna look at the state ones, and we're gonna be developing this other thing for community RFPs.
Okay.
So that it happens at the same time. I just worry that you bring them here to do these things. I just don't know what's our process gonna be. Are we gonna vote then on these things?
Well, you're gonna, any way you would do it, you would bring it back to the full committee.
Right.
So you're saying that rather than bring it to the full committee, you assign this, the council assigns this to the grants committee as to explore further what the state is requesting. The grants committee review it, and then bring their recommendations to the full committee, if that's what you're suggesting.
I guess I'm suggesting that, yes, that is what I'm suggesting, along with what their plan is for doing, for like a big picture plan for how the funding gets committed, so that you could commit early some money, but that it's in the context of the actual full process that we all are gonna agree we wanna
Yeah.
have for it, so that this doesn't become like a sub thing without knowing the big picture of how we're gonna fund all the things that people might wanna say to us that need to get funded.
I mean, Paul and then Courtney.
I just don't think, oh, I'm sorry.
Just wanted to let you know.
Okay.
I just don't think the two are mutually exclusive. I think we can do both.
Mhm.
I think that we can work on the process. The grant committee can work on their process, the finance committee can work on that process. And at the same time, we can all get more information, DHHS, on these wonderful ideas that they have ready to go and maybe shovel ready. And then we can decide, is that what we want to do?
Correct.
Great, I'm in agreement.
Correct, because it's the council's funding. So say, for instance, if I'm not picking on anything, but Courtney mentioned the shatterproof, that it wasn't that grants committee may say, we love the concept of a stigma campaign, but we would like that to be out. We would like that to be RFP'd rather than sole source to somebody.
Mhm.
And that's the council. And again, I'm not picking on them. I'm just saying that's the council's decision to make, saying you can even say to the state, we love that idea, but we want an RFP. And they have the process to do that. Courtney and then Joe.
I think I understand, I hear what Liz is saying, but I wanna make sure I do. So I think I hear you saying that this state process needs to, like, the state needs to apply the same way that communities or organizations, and that all that happens at the same time. The
Not
decision-
necessarily, I guess I just don't want it to, I want to make sure that we have a process for how we're coming up with what we're funding before we say yes to funding this stuff. So I'm not saying they have to go into the same process. I just want them to happen at the same time so that it doesn't feel like a whole bunch of stuff gets shortchanged, or that we haven't heard it all, or that we haven't figured it out yet before we say yes. So and I feel like when we come here to have these conversations without knowing what our process is, I don't know how to vote for that. Do you know what I'm saying? Like, I don't know how I would vote for that.
Yeah, so,
Because
yeah.
yes to these, but maybe yes to 10 other things that we just haven't discovered yet. So I'm not saying they have to use the same
I'm gonna take
process.
Joe and then Ben.
Real quick, I think that the state should have the same process as everybody else, just so that that is clear. I think they should have to apply, and
but-
the money should be sent out at the same time
I-
that everybody else.
I just want to point that out. Then if that's the case, be prepared. Just want to prepare you. You will not, no money will be dispersed from this committee probably till spring.
Right, and my decision is, I think that is the responsible decision.
Joe and then Ben. Thank you, Courtney.
Put it on the list.
You can get on that list.
Joe Everett here, and my response is kind of in line with what's been spoken about, in that I think I'm struggling not hearing feedback from, or not hearing from other stakeholders. So the department they're a stakeholder. They came forth with great ideas. Sarah's presentations were amazing, but we talked about getting feedback officially or formally at the summit. Did we do that? How did that go? So I'm really needing to hear from other stakeholders, people who benefit from the services, need the services. After last meeting, a few of us talked about wait lists. It is enormous, Pat, to your point, having worked in the field. There's like a lot of people on a lot of wait lists. So I think just hearing from other people, to me, is important. As we've heard from the department, I like their ideas, but what else? What else could I learn from and about?
Thank you. Yeah, thank you, Joe. We're going to talk about actually soliciting some input in next item on the agenda. Thank you, Ben, and then Todd.
Yeah, I agree with everything that Joe just said. And I was just gonna highlight, when I hear process, which I agree we need to establish a process, I think of how, right? Like, that's how we're gonna push funding out, like through contracts or RFPs or capacity building grants or match programs or something. But like, we also need to establish our priorities, which is the what, right? Like, so we need to marry those two things up, because we don't have a how or a what right now. And we need a process we need to do both of those concurrently. We need to establish what our priorities are and then figure out how we're going to implement them.
Mhm.
And that is, that's what I hear when,
Mhm.
because process is not just like what the priorities are, it's just like a vehicle to realize our priorities, I
Right.
think.
Thanks, Ben. Todd?
Yeah, and at the risk, I don't wanna try, I think we're saying the same thing, so I apologize ahead of time if I repeat something that someone's already said, but. I think the state has an advantage, it's not an unfair advantage, it's a natural advantage in that, you know, they knew this money was coming, they were watching the process, they're at the table, you know, this is a state-driven project. I'm not sure the same is true for, you know, there are several municipally sponsored programs or locally sponsored programs that are probably we're also aware, but I'm not sure that they're in tune or we're here to make a present. In other words, there may be other places, I think we're saying the same thing, that we could quickly get money out in a program that's really working, state-based or otherwise. I'm not opposed to that. The other question I had, and I apologize again, I do this a lot, I apologize. I would just like to better understand also before we make this final decision and maybe Brandon and somebody else has already explained this to us, or it's in the documentation that I've looked at and forgotten or haven't gotten to yet, and because there's a lot of stuff out there for us to look at about I'd like to better understand what's happening with the money that the AG has as well. You know what I mean? That's probably all been earmarked, already been spent, or good ways. I don't know. But I would like to have a better understanding of that as well. I don't know if that's something, and you may have, like I said, you may have already given that to us, and I just haven't, I've forgotten it, and but I think it's something we should consider.
That's fine.
So to your point, Ben, I guess I would love to, if other people are interested, it feels like part of work that the council could do is coming up with our priorities. So then we can figure out how to fund them. So instead of having the department come back to tell us, like having them do, like come up with like, what are our priorities? How are we gonna set some aside, some priorities, like some funding mechanisms? I just know that usually when we don't say we're gonna spend a third, or we're gonna spend 10% on, you know, prevention, or usually prevention gets about 1%. So that's historically across the country, it gets about 1%. So it is the piece I'm gonna bring up as an advocate to say, like, if it doesn't get if we don't say that it is a priority, it most likely will get less funding, all the other funding, which are important things again. But so how will we determine our priorities, and is that a possibility to discuss where that fits into our council discussions?
Yep.
So I think one reason why I'm out of sync with the rest of you on this is that I just went through a year to do a strategic prioritization. And we had 1,000 public comments on this plan. I don't expect you could develop any process. You could have 30 community forums. I don't expect you to hear anything dramatically different than what we heard in preparing this plan that we published 2 weeks ago. So I'm ready to spend. And again, so I just want you to know that's why it isn't that I think the state should get an advantage. It's just that I'm sitting here as one of the governor's 2 appointments. And we have our plan. We have 9 focused areas, 34 strategies, dozens of activities, some of which are not funded. So I'm going to continue to press. We have 12 people a week dying.
Would you like to propose that the council take this plan as the way we determine priorities? I guess I want to just say, I'm with you, Gordon. I want to spend the money. People are dying. We all want to spend the money. You've created a plan. I feel like we need to discuss how are we prioritizing then? Are we going to take this and adopt it as our priorities too? Or do people want to make amendments to it that they can? Let's get to our process so that we can spend the money. And I feel like that's not clear to me. And maybe it's clear to others. So if it is, please tell me.
I'm not asking you to adopt that plan. And I was simply making a comment so that you understood why I not in agreement that we ought to have an extensive amount of process because we've already had a lot, in my opinion. And I agree with Ben, the process of getting the money out the door, that's procurement, that's contract. It's a matter of establishing priorities. I was simply suggesting something that I thought was quite reasonable, that with respect to some urgent needs that we might all agree on, set aside a piece of the money now, have two parallel tracks. Maybe that's gonna, because pretty soon that 14 million is gonna start growing. And pretty soon there's gonna be, people are gonna look at this and they're gonna look at what the other states are doing. And they're gonna say Maine's fallen behind. The problem in Maine is just as bad as any place else, and yet they're falling behind. I'm trying to prevent that. I think we've got some things that are obvious needs that it's going to take a long time to get from point A to point B. So the sooner that we can make a decision, then that, yes, we can take $600,000 and do this, then we can start the process piece. And I'm not, and I agree that you absolutely should continue to work with the Attorney General's office and ask for where that 20%, what are their priorities? They've only, so far, the Attorney General's agreed with two projects, as I recall, based on conversation between himself and the governor. And I think you well know that they're funding are expanding our behavioral health liaisons from 16 to 32 and put in some money for naloxone purchasing, I think. So again, I don't mean to be argumentative. Lawyers hate to argue. I just wanted,
Love to argue.
I simply wanted to know where I was coming on behalf of the government. Thank you.
It's drug, it's not law.
It's drug.
Oh,
courts.
yes, okay, yes, yes, yes. Family
Courtney?
courts, yeah.
I have a suggestion on the what and how to prioritize, and this is just my suggestion, so I'm just gonna put it on the table because I feel like at some point somebody has to. We have $14-ish million in the bank right now. I would suggest that we prioritize the 4 pillars: treatment, recovery, prevention, and harm reduction, by giving each of them $3 million, as well as the other $2 million be prioritized for BIPOC and LGBTQIA+ community member projects. Everybody gets a fair share, every pillar.
3 million each.
3 million each plus 2 million for projects that prioritize BIPOC and LGBTQIA+ and other marginalized communities.
So my thing with that would be, it seems fair, seems reasonable, seems easy. Mine would be when we get to the process of putting RFPs in place and we discovered that not all the money was asked for, or more money was put in this pillar versus that pillar. And when reviewing the grants, we think, whoa, we should be crossing that over, because again, it's a matter of when we start specifically pocketing things into boxes, then do we cut ourselves short of looking at grants and priorities? I mean, that can be for me the ultimate goal. We want to take all of the pillars and distribute equally. But it's hard for me to say that until I've seen all the projects presented in front of me. Because I may say, well, this could really be impactful, but that's too much money to ask. Again, that's just sort of what comes off my head when I hear that. But it certainly is a simplistic way to start. And we need to start somewhere. Paul.
It's not clear to me that all 4 pillars would require the same amount of funding to achieve a goal that we would be looking for.
Yeah.
Though I agree with prioritizing
Mhm.
all 4, and I said that at the finance committee.
Yeah.
Prevention is going to be much more than 1%, I can guarantee you. At least in my mind.
Yeah, and again, we don't know, again, part of the issue is if the state is spending, and this is a number thrown out of my head. If the state is spending 80% of their money on treatment, should we be taking some of that, our money, and putting more into prevention or harm reduction? Because that's a gap in the state funding pieces. So that's the only when you equal things out. Chastity.
That was my question. Do we know how the state breaks down amongst the 4 pillars that they're spending roughly?
We have some pie charts that attempt to do that. I think it's a little rough, but we do know that. But that's only the money that's really flowing largely through the Office of Behavioral Health. You've got all the other pieces, I mean, I like Courtney's idea on an aspirational basis. But I think the other problem you'll see is that sometimes a project is hard to divide between, well, is that prevention or is it treatment? Some of the harm reduction looks like other things. So I think it's difficult to do.
That first talk.
So, since we're kind of thinking out loud, as everybody's talking, everybody's got some wonderful ideas, I think. Is that I would really like to find a place where we can get some agreement. And also discover what our priorities are. So let's just say we've got 14 million, right? And what if we say, what if we agree as a group to say, let's agree to set aside 3 million or $4 million. And out of that $3 or $4 million, we decide what our priorities are for now, for the immediate future. So some of these things are going to rise to the surface, I think, that have already been determined. But that we show, one, to the people that have entrusted us, that we can get some things done. And then also that we've discovered together what our real priorities are as a group. And then also it will help us to move forward as we prioritize moving forward. The other quick thing I want to say is, I'm just hoping that we don't get caught up in this enhancement of existing programs, that we as a group cultivate creative ideas and hopefully this stuff that's coming from OVH and DHHS is a way for us to also discover what's missing.
Yeah.
And I know a lot of folks are thinking that right now, but if we could agree to set aside a certain amount of money together and then prioritize together things that could be funded immediately, that's.
Sue. Looking for something. If I can make a suggestion, as I'm listening to people, there's a couple, one that comes to mind, the first one is set aside this September meeting for most of it to be a conversation about our priorities and to really vote and look as a group in September, coming up with a plan of our priorities and having a real in-depth discussion on what are our priorities, what do we see as a group, and really spending the bulk of that meeting in September coming up with that list. Does that, I'm not going to take a formal vote, but I'm looking for a nod ahead. Does that seem like a really good thing? And in that, we can also have Ben do a short thing about how much we know. We can do a little money thing here. But I think, first of all, we need to come up with the priorities. And then the money piece will fall into place somewhat as we look in is where our priorities is as a group. Because we've never really had that discussion. We talked about bringing in an outside facilitator to do this plan and we never did it. We got tied up in logistics of bylaws and all that. So if this seems reasonable to everybody, the September meeting will focus on and we'll come up with some key questions as to how we can brainstorm our priorities as a group and what it looks like. And we can start by using the pillars. And where does that look like? And we can use this plan, the action plan, as a guide. And we can certainly look at where the state is. And again, I'm not one to reinvent the wheel. So there may be some things in here we're saying, yeah, this is, for us. And we can figure out a way that makes sense. So the September meeting will be that. If I'm hearing right, if this is what people are in agreement with, the grants committee really needs to meet. And I'm looking at Joe because Joe's going to chair that meeting, that if you guys within 7 days, I'm giving you 7 days, come up with a meeting date and we can send a meeting doodle out to the grants committee, that the grants committee meet. And remember, every committee has to have a 7-day notice because they're public meetings. And I will, Joe, you and I will talk about setting up that Google Meet. And then at that meeting, I think what I'm hearing, the majority of people, what they want is that grants committee will look at the 8 priorities that are here and make a suggestion, not necessarily vote on these particular ones, but what would they like the procedure to look like going forward for these 8? And I don't mean, again, looking and saying, oh, we like that would come up with recommendations. What I'm saying is, what are the questions that you have of the state? How are we going to, you come up with a procedure, again, with the grants committee. At the same time, you need to gather a list together of things you need, like, Brendan had just passed out some applications from one from Massachusetts soliciting information, and one was from the opiate settlement committee from Franklin County, a survey that they sent out. Yeah, so there's some things that you can look as a grant, as a program, but you have to meet and you have to look as a group as to how you want to do things. But I think what we'll do is we'll take the state priority list and let you come up with what you believe is a fair process to go over this. Does that make sense to people?
Yes.
Thank you.
Yes, but I do want to make sure, we also need to have on the September agenda, the conflict of interest policy.
Oh, yes.
Because the public needs to know, even when this group is talking about
Mhm.
their priorities, they need to know where our conflicts
Gotcha.
are. And and that should be relatively easy, with Brendan's drafted policy.
He's got the policy.
And we just need the governance committee to meet, look at it, make a recommendation to this group, so we should be able to take care of that fairly quickly, I would hope.
At the first part of the September meeting, I will get on with the governance committee, get a meeting doodle out to them, put that on for next month, and then in September, we can put that on the top of the list, conflict of interest policy, and then move forward. Does that make sense? I'm gonna
Is the conflict of interest policy gonna be instated by the time this talks
Conflict
about?
of interest policy, I
Or-
believe we have to go by the public hearing rules. No?
No, I mean, it's an amendment to the bylaws, so.
Excellent.
You just follow the policy and the bylaws of amending it.
So everybody should come to that meeting ready if you're gonna talk about something that.
Correct. If you have questions,
Have a
if you have
conflict.
particular questions that go, a legal question, give them to Brennan and then bring your questions. And then hopefully be able to vote on it.
So my recollection of the procedure was that the governance committee, the council wanted the policy to go to the governance committee first, for the governance committee to assess it and to make a recommendation to the full council. So I think what you're suggesting is that whole thing happened so that at the September meeting, the council can receive the recommendation from the governance committee.
Yes, sir. Can vote on it.
Yeah, and then I think what Courtney's getting at, I don't want to put words in her mouth, but that the what's a step in that recommended policy or that drafted policy is that we would then file a disclosure statement. And so that's not all going to be done, obviously,
Right.
that day in September. So what I would suggest is that, and we can do this in September, is that there are timing elements in that as to when annually the thing would be filed. But we would probably have a motion that we would try to have our disclosure forms filed by the October meeting. Or maybe by so that as we're talking about these priorities, people will know where the conflicts are.
Right,
That'd be my.
right, but, and then we're also like, if we were to. Hypothetically, I work for the Maine Recovery Advocacy Project, we are not looking for funding, but if in a world that we were. If I was advocating for that, I would have to say that.
Yes, you would
Right.
disclose it.
Yes.
Okay.
Yes.
And in some cases, you wouldn't vote. You would
But I could do that. I can say, I work for the Maine Recovery
Mm-hmm.
Advocacy Project and I am advocating that we receive
No,
$1 billion.
you can disclose, but then you have to recuse
You
yourself.
have to recuse yourself.
You can't advocate.
Okay, got it. Thank you.
Todd.
Gordon, you referred to I was able to find the 2021 strategic plan.
Yeah, this,
looking for the.
this is the updated.
I
this
was,
is the
I
updated
haven't been
one.
able to find it. You said it's on the ed care. I'd like to take a look at it, because one of my questions is that. I'm supportive of trying to get some of this funding out as quickly as we can. But what I don't know is in that plan, does it identify? Does it talks about needs, strategic areas? Does it talk about programs that are on the ground running now?
Yes, there's a progress report section that.
And
first
are
we
they all
say,
just state programs? I assume they're not.
No, we try to be a little more holistic than that and
Yeah,
recognize.
well, and I didn't mean to imply that you weren't.
No, but I had thought that because this was given out at the summit, that most of you had it, but I have it in a PDF. That I will send to Haley and Brendan, and so that all of you will have the document. The PDF is right now is exactly this document as a PDF. We will obviously, as we continue to work on the policies and make revisions and update things, we'll do that on the PDF version. We're not going to be printing more copies.
And they mentioned specific programs in here, and again, as Gordon said, progress.
Where I'm going
Today.
with it for me is that I'm gonna be more comfortable moving expeditiously, me personally.
Yeah.
If I have a better understanding that we've heard from some other people who are on the ground running right now,
Yeah.
not just the state programs.
Right.
You know what I
Which
mean?
is-
So if they're in there, great, you know what I mean? Just so there's, in my mind, at least there's some equity there, not that there isn't, but.
No,
Which is
That's
the
just
next
me
item, which is the next item on the agenda.
I just want to
Next.
make one comment.
Yeah.
Just to follow up, Sheriff Brackett, on your point, and on the discussion of the council's priorities, just a reminder that the council's responsibility is to spend these, is to distribute these funds statewide or on a statewide basis. That doesn't necessarily mean you have to spend the money like all over the state. It doesn't mean you have to spend, all of them. You don't have to fund each of the, menu items in the approved uses. It just means you have to, the council is responsible for, unlike the money that went to the subdivisions. Spending the money, on a statewide basis. So the way I've been looking at, the council's responsibilities are, look at what's happening around the state, take into account the other things that are happening around the state, like the money that OBH is already spending, like things that the legislature is already spending money on around the state, like the subdivisions, settlement funds and what they're spending money on, and take that into account as you look statewide. It's a reminder that this council has a different perspective than, the subdivisions, for example, the cities, counties, and towns. What makes sense for a county to spend money on, or a city to spend money on, it may not make sense to spend, it can't spend money beyond its jurisdictional borders. Maybe it can, but leaving that aside, it's not going to. So there are ways for the council to look to have a perspective statewide that, the subdivisions don't have. And that was the design of the Recovery Council.
Courtney, and then Ben, and then we're going to move to the next agenda on it.
Is there any limits to what types of organizations can be funded, such as 501c3, 501c4, for-profit, nonprofit, government?
I don't think so.
Yeah, I think it's really just what the council decides is appropriate. It's part of its priorities.
Okay.
Well, as long as the use is within the abatement.
Yeah.
Right, and
Yeah.
I'm talking about the structure that you fund.
Yeah,
not-
yeah, like for instance, some of the sober homes are not nonprofits. So if I use what I'm familiar with, Fresh Start is an LLC. It's not, it's a for-profit organization.
Right.
So as far as sober housing is within the MOU, within the guidelines. And again, they're not a nonprofit, they're a for-profit, and they could apply if we had something for housing, Ben.
Just hearing this discussion, it sounds like we started our process to collect information, and that process is not over. Obviously, we have
Correct.
additional stakeholders, so I don't know if we want to all agree to read the most recent strategic plan and review it from that input process, or if we want to have a forum to hear from the people of Maine that might have ideas and have a public hearing around that? Or, I'm sorry, is this the next agenda item?
That's the next agenda item. You're going right in there, Ben. So it's absolutely perfect time. Todd saying the same thing. So one of the things that we brought the state in, asked the department what was going on, where their gaps are, what their recommendation. There's also other entities out there. There's the Department of Correction, there's schools. We haven't even touched on the fact that a certain portion of this funding has to go to schools. We haven't asked schools what their needs are or their gaps. We have, what are the municipalities, the cities and towns, what are they doing with their money? Because we certainly don't want to duplicate that. We may add to what they're doing because they can enhance them, but we certainly don't want to give them money that they have enough to do what they need. So the next discussion really is, in order to look at things, what do we need for data and who do we bring into a meeting to hear that information?
Where I was trying to get to is that if there's an existing program, I'm just gonna pick on Betsy because I can see her over there in the corner. In Machias, right, down east, that clearly is located, maybe even funded largely by the town of Machias, city, whatever it is, or whatever. But Machias being a servant, you know, there are folks coming from community to community, much like they do in Portland. You have Portland, Westbrook, South Portland. I'm assuming Bangor, same area. It's okay it would be an appropriate use of our funds to supplement potentially a program that, like, if there was a program that we could find out about in a short period of time, not new, not reinvented, something that's already in place and has some history like these state programs on a smaller scale, obviously, that we could find out about. Were you saying, Brandon, that it would not be appropriate for us that may be looking for $250,000 to continue their MOUD program or whatever it may be, that they have in place, that it wouldn't be okay necessarily to do that because it's certainly going to impact Washington County, but it's going to impact more than Machias, in my opinion, because where people, I'm just trying to understand.
Yeah, I'm not being categorical and saying that, if somebody's already getting money, this council can't spend the money. The point was, if some of the money has already been distributed to like the local level, through the 30% bucket, right? But there are lots of places in Maine that didn't get the money. And the point of the Recovery Council was to look on a more statewide basis for what other needs are not already being met, at the local level, either through, municipalities' own money or through the settlement fund. So, that certainly doesn't preclude the council from looking at, getting an application even from Bangor or Portland or, Cumberland County and saying, we're doing this thing, we could amp it up and we'd like some more money for that. That's, I think, supplementary, not supplant. It'd be different if a municipality, if somebody applied for money saying the municipality, shifted the money away, so we'd like the money from you instead. That would be supplement, supplant. And I think, the larger point is, at some point, and I've got an eye on reports that need to be filed with the legislature coming up soon. There's already questions about what the council's doing, and that's natural. And the questions are being asked at subdivisions too. At some point, after the council starts to make payments, there's going to be questions along the lines of why did you choose to do that? And so I'm, in terms of structure, I'm thinking of, it would be ideal if the council can point to, we made this funding decision because, and then you point to the data that shows the need, and then you point to other data that shows spending, and you can say, and then you have your rationale. Whatever that is, that's really up for the council. The priorities are up for the council, but at the end of the day, the council, I think, wants to be in a position where it can justify its activities, its payments, and in my mind, but you all may have a different way to do this. In my mind, the way to do it is to say, we chose to spend this money because there was this need here. We saw that it was met or it needed to be increased. or not met and need to be increased. And, we looked at what other funding was available to it. We saw not enough or no funding and, whatever the other rationale is. So does that help?
It does, thank you.
And I guess I'll just add to that, so that I love, so I think. We have all the work that you all have done to come up with what the state's priorities are. I think we're hearing that people feel like the council itself should hear from folks. And that also, I think, I'm wondering if it's possible to do a couple surveys for some different groups of folks, so that we can get some stuff that's just written down. I mean, I've done a couple sessions with, like, across Cumberland County. I've done it like several times where we do a brief assessment where we send out a survey and there's specific questions for folks who work in law enforcement, who work in harm reduction, who work in prevention, who work in treatment, so that you cover and we ask them, what are you currently doing? What are you missing? Where do you need funding? What do you think the council should spend the money on? What we can ask municipalities, what are you planning on spending the funding on, so we can hear from them, get those in survey form. And then also have a forum where folks from the public who they could fill out a survey, but they may really want to come and speak to us and like be heard. And I feel like the being heard, I know you've done this, I've been a part of many of those listening sessions, but we as a recovery council have not, and it feels like people want to be heard. So can we do a variation?
Correct.
That then helps us say, okay, now we've got the data from the state, we've got the money that's being spent here, we've got the surveys. This is why we're making these decisions. I guess this is what I was saying about this earlier.
Yeah.
Like, I need us to have a plan.
Yeah.
That
So-
gets us to saying why we're funding what we're funding, exactly what you're saying, Brandon, because I can't point to why. Like, I need all that data.
So one of the things that we were discussing, and one's more complicated than the other, so I'll do the easy one first and then the harder one. So one of the thoughts that have been in my head is about public comment and how do we do that? And I think one of the advantages we have in the state of Maine is we have peer recovery centers located all over the place. And I was just wondering if you could use a public forum in my town where I live. That's a community place, the recovery center. People come in there, city leaders come in, healthcare providers come in. Again, that's just, so we need to find a mechanism to ask people out of the community. However you do that, whether you use the peer recovery centers or not, just for me, they would probably do it for free for us and provide a space. But certainly we could look into figuring out getting visual public contact with people. Some of us as council could attend, all of us. Again, those are just ideas. The other piece was developing a request for information, an RFI, where we send it out looking for information, and basically we start surveying with this request for information, and Brandon can get into more of the details of that, asking people information about what are your needs, where are the gaps, what do you see, how do you do it? Again, or you invite people here to tell you. Those are your choices that you have.
Are you suggesting that we as individuals go to our recovery centers and try to?
No, as a group, we would actually advertise public forum sessions. And it's just my suggestion. It's nobody else's, so you can throw it out the window. It doesn't matter. I was just trying to think of some way. And again, the recovery centers might be welcoming. You could use recovery homes. People could, again, they're a place to gather to get information. So that was mine.
I feel like using recovery centers, recovery homes, that's gonna delay us even more, trying to figure out to travel all over the state. I would like to see, just like you do in the legislature for committees, people have the choice of in person or Zoom, and we can get more people that way.
I like that idea.
And with survey, get AdCare on board to blast it out to everybody.
I like that idea. So do like the legislature, have one day we pick, we advertise the day. And then we just listen, and I mean, that's what the legislature did. They may ask clarifying questions, but they basically listen. They don't give information. They basically listen, ask clarifying questions. So if Courtney said something, they'd say, I don't know, what is that? And she would explain it further. Okay, Bruce. And then
Yeah, and I totally agree.
I love that idea.
Distributed survey, just, in all of our networks, whether it's MIRAP or NPRN or or, any of the other
Mhm.
CCSM and CCSM, da, da, da,
Multiple
ag care, all the things.
listservs.
Just get it out there, and then the other part, having it be a public forum, and so if we're really statewide, then we should be accessible from any corner of the state.
Right, and I really do like that idea of following the whole thing of people getting in and they can actually come in person and if we just push the advertising out, I think it's but I'm only one person, Courtney.
Yeah, I was just gonna say, I love the idea of just a straight up public hearing. It's a neutral space for all. Everybody can get here either in person
Yep.
or on Zoom. I'm wondering if maybe September would be a good time because we could have a public hearing. We could have a public hearing and then we could spend, I don't know how many people are gonna come, but hypothetically, it could be the public hearing and then the council could have a conversation about priorities.
Yeah, the only problem with September, it is recovery month, and I don't know how busy people will be.
Well, it's a good recovery advocacy moment.
I think so, but go ahead.
Well, I think when there's public hearings, the legislature, remember, people are reacting to a proposal. There isn't an occasion where the legislature says, come in and tell us whatever you'd like. They're testifying on a bill. I do think that it will be more meaningful. You will get things that will be more useful, I think, if we ask them to react to a document. Once we have a list of our priorities, then you invite public comment on our draft plan. This is what we've been doing. This is what we're thinking. Please come in and give us your thoughts on this document. Whoever chairs the hearing would probably be Pat, can certainly be liberal if somebody goes off chat and says, I've got an innovative idea. You've got 3 minutes to do it.
Yeah.
But I just think it's otherwise I don't want to denigrate in any way the ability of the public, but we've been at this a long time. We had 29 public forums in 2016. You remember Carol Kelly facilitated 28 of those sessions. We had hundreds of people come. We had 400 people that day at Washington Academy. And you get, it's very meaningful and impactful, but you do get a lot of agendas and not all of which will be relevant to this work, in my opinion. So I'd rather have a draft plan that that the public can react to. I just think it's more meaningful.
Todd and then Chester, and I will say one comment though, although if I remember, we asked the public and then developed the strategic plan.
That's kind of where I was going. I would think the survey would be the public
We
document.
did it, well, no, actually it was sort of tandem, I should say, it was tandem. When we had the subcommittees, you were out getting the information that was brought, and then the strategic plan was built from that. But I see your point. I do see your point in public comment, if they have a specific comment to do it. So I see both points. Todd, and then.
Is it possible to have like a parallel track? I don't have any problem with asking and having public hearings. But I also feel some urgency, right? And I could sit here from a law enforcement perspective and give you at least 3 examples that have happened in the last 2 weeks. We need to spend some money. All I care about is, and I think there needs to be a balance. I hear that, I'm all about it. New initiatives, I heard Bruce talk about it earlier, and others, I'm all about it. But as a council member, I would like to, I'm wondering is there a way to have a parallel track? Because I would like to be able to have public hearings, hear about new innovations, new whatever. But at the same time, can we get some information, kind of like what we got from the state? That was easier from, they have it consolidated and all in one spot. It's probably harder to pull it together. So we could better understand, is there some other area opportunities for my words, low hanging fruit, easy ways that we can all agree as a council, and we would have to agree, where we could begin to direct some funds, maybe quicker than others, or they're more emergent than others. or programs that, that are out there. I don't know, maybe that's not possible. Maybe that's already in that document that I haven't seen. Some of those, things are in there. I suspect probably the ones we saw here are in there, but, is it just me? Is that, I'm asking my peers around the table, because I'm all about having public hearings and finding out more. I'd really like to know. I don't want to wait, but at the same time, can we somehow strike a balance? And try to, as it was said earlier, somebody mentioned parallel tracks, and maybe that's what we're all saying.
I think we are, and I think that, there's a sense of frustration among all of us that we all know of wait lists, and we know of programs. I mean, I got an email that I've had, saying there was a recovery center that was in desperate need of money.
Yeah.
And I'm thinking of and they asked the council, but we don't have a process yet. And I do know, it is as hard as this is, if you don't have a process, somebody's going to think it's unfair. And you start to create an atmosphere, a negative atmosphere. And I don't think that's what the council wants. And I'm going to use an old example, and I know I'm public, but I'm going to use the old example. When the state first decided to help fund recovery centers, they sole sourced the Portland Recovery Center. Bangor is still resentful over the fact that they sole sourced it. And if sometimes you can see them, the barn, although eventually they got their funding and they got again, but that resentment took a long time for those two centers to actually work together. They're now fine and they work very collaboratively, but every once in a while you see that. But the state, and again, it was wonderful. I love the Portland Recovery Center. It's a high population. It probably was their best choice, but they did it without conversation, and they thought, oh, this is a good idea, and did it. So sometimes I wonder where that poor recovery center that was in need of money, you just want to write them a check and say, it's a good job. But then you have the next recovery center saying, you gave them money. Now we're hurting for money. So again, if there's not, and I know it slows it down. I know it does, and it's frustrating, but I think we can keep moving forward and we can get to that point. I think it would be nice to say that in my United Way world, we have a thing called innovation funds. And so it's always money set aside every year when somebody comes up with a new project or needs money. They have a quick application process to file it, and we can fund innovative projects. We don't have that yet. And so I think but Todd, I totally get where you are, at least just for me. But again, we are just in this infant stage of where we are, and we're trying to grow up really fast. And it's hard, because there's a lot of need out there. There's a whole lot of need. But thank you. Your input is important. Keep pushing us. I like that. Keep pushing us to make it simple. I sometimes complicate. I'm a detailed person. So you need to stop me when I do that. Okay, so if I hear right, we are looking at the possibility of having a public hearing day. I don't know. Is it just me? Do you feel you're ready for that in September? Or there's a part of me that says it would be nice if we had a priority list or something, some sort of statement or priority to be able to put out with our public notice asking for input and make it in October.
I just don't know how to make my priorities without hearing from people.
Right.
Like, I just don't know. Like, I literally can't do it because of everything that I have done in my life and the way that I operate in the world.
Can we do the surveys? Like, I feel like the surveys are simple, like we can do them now. They're easy to do. I have templates that we've used in the past in public health. I'm happy to share them, and they can be revised and used. Can we do some surveys of like?
I think we can start, and then that can be the document that goes to the public for them to decide what they're gonna come and speak about.
As long as when you survey, I love ad care, but they have a tendency to be providers only.
Right, I
Yeah,
was just
and so
thinking
we have-
listserv, so like literally all of us serve.
Sorry.
And there might be, the way I've done some of the surveys, we're trying to do full pictures.
Yeah.
People can opt in to sections of it if
Yeah.
they want to. Like, I have things to comment on in harm reduction. I have things to comment in prevention. They don't have to comment on everything. They can comment on just parts or everything.
Yeah.
So that you make it simple for some people. But we get all the information in one document and we do it, and I'm just happy to provide to someone. It doesn't have to be me, I can help do it, I don't care, but just offering to do that.
I may take you up on that 1 second, or we may take you up. Kina has her hand up.
Oh, yeah, thanks. I was just going to comment on that. If we do survey, I just want to make sure that we're reaching the people that we really want to hear from, especially people of color, people who are actively using, like you said, I think I'm not a marketing expert, but I think I just want to make sure that we reach the people we need to when we survey. That was all.
Excellent point.
Yeah,
Bruce?
and I'm just in total agreement with what Courtney and Chastity are saying. And I think that informs us as to, what the priorities are. It's coming from people. The other thing, I just wanted you to be rest assured that this information will get out to everybody. And I'm looking at Courtney and Chastity and Lynn and all about it. There are so many community organizations that we're all connected with. The harm reduction community is going to hear, to her point, folks that are in active use are going to be able to participate. Everybody's this survey will get out to all of the cracks and corners.
And if we use even our influence that we may have with the sheriff's departments, asking people who are currently incarcerated.
I can tell you, we can get it to all those folks that are incarcerated in jails and prisons gladly.
And ask them, okay, so here, all right.
Can I just, does it, I have 2 things, does it make sense for the surveys to sort of be, for there to be multiple surveys that are sort of disaggregated along the lines of so the agenda item is, what are the groups we want to hear information from? So we've talked about wanting to get information from state agencies. We've talked, could there be a survey to the subdivisions? Could there be a survey to philanthropy?
Yeah.
I know Gordon meets with, or I think you've said, it would be useful to, for this council to get on paper some data, some information from philanthropy. I'm not saying nonprofits, I'm saying philanthropy because I think that's helpful. Maybe there's a separate one for nonprofits, but I don't know. You're all the experts. There's Pat's talked to me about an existing opioids committee. I don't remember the name of the one.
Substance use disorder committee?
No, the governor's commission.
No, the
Oh,
government.
the substance
Substance
use disorder services commission.
Commission.
I mean, maybe they've got data or information that the council could use, there could be other.
They've got thoughts we could hear.
What's it?
They've got ideas that we could hear.
Yeah, they have ideas. They have a whole plan.
Can we also make sure it's in multiple languages too?
Oh, that's a good point.
So that brings me to my second point, which is, I think it's a good idea if there's a self-selected group of this group that puts these surveys together.
Liz.
And we may need some, little bit of funding for translation services, and we may want to do some interpreter. I mean, if we want to do this, and if you want to have a couple community health workers who.
So I hate to put you on the
administer it.
spot, Liz, but would you lead this?
Yes, I will happily lead the survey.
Okay.
committee.
And can we put a deadline on it?
The
A
survey.
deadline would be good, but here's
Dissolving.
here again is my issue. You wanted to discuss priorities at the September meeting. That gives Liz only 4 weeks to do that. So do you want to put that back a little, that priority list, until Liz has time to develop some people to help and get that out?
Yes.
Yes.
Okay,
Now, how long does it take how long would you want to give people to fill out a survey?
if you,
I mean, depending on it depends on what the survey is or says, but how long do you want to give
15
people?
days.
I was gonna say in 3 weeks, it's usually.
Two
2 to
weeks.
3 weeks. 2 weeks. you
Yeah.
can do it in.
2 weeks.
usually people, I used to work in a statistics office. I have a weird career. Anyways, the thing is with surveys, usually people fill them out right away. Or they put them in their inbox to do later and they never do them.
Right.
So if you're giving them 30 days, they're never gonna, again, give them just a couple weeks. It's just my experience from doing surveys at the hospital.
So
Some of
wait,
us get 10 of them a week.
so once the surveys come in, is this group going to do something with that data, that information? And do you want time, how much time do you need for that?
So
Please, Walter.
to think what my thought was that Liz would do it. We'd have to figure out a way to collate some of it, then that collated information would come to the meeting where we talked about our priorities.
That's not enough time for September.
No.
No, it's not gonna happen in September.
It will be October.
Yeah, we're gonna have to wait till October.
And the public meeting in October.
So I thought that was. Is that not?
Well, you can do
We could do the
September
public
now,
meeting
if
in
we're not gonna
September.
hold the strategic planning meeting in September, we can hold the public hearing in September. But you want,
They won't have anything to react to.
yeah, if you want them to react to our
Right.
priority list, then you're gonna have to wait till October and
That's what
November.
Gordon, right, that's what Gordon's
Yeah,
suggestion was. So we'd have to do the public hearing in October.
Or November.
or November. It depends on how fast we can get the survey out, get results, tabulate them, and then in October, we prioritize them. If we think we can get, and our meeting is the first part of October. So we could plan the end of October, a public hearing. Once,
Separate.
Yeah.
Separate, okay.
yeah,
I just might need some help on if people help me, it's a public meeting, so just wanna
Yeah, we can,
clue in on, I just need
Yep.
some guidance on that.
Yeah, what is the form of?
I think,
I'll
I
help with
I think
whatever.
the rule
Thank
is like 3 or more members, then it's gotta be public,
That's what
Okay.
council
the
is.
statute.
Okay. So maybe we can meet in Tuesdays.
And
I'll meet with you, then I'll meet with somebody else and then we'll fit together.
you can do things.
Yeah.
Via email. Liz can do something and then ship it off to a couple people for reaction, and that's, yeah.
would it be helpful for one of the surveys to be to the general public?
Yeah.
You can have targeted questions that receives targeted data, and then in addition, have a public meeting.
Yeah.
For general comments.
We could do that.
Yes.
And then again, I'm assuming you'll hit all the pillars.
But we could actually do that for September if we wanted to. We could have, by September, I think you could have it open for 2 weeks and have people then do public comment at the end. While that
In
is
September?
open, yeah, in September. So that it's, you can come and do a survey, or you can provide public comment on this date and have them open at the same time. So it's 2 weeks of,
I just wonder if there's enough time between now and the September meeting to write a survey, distribute a survey, give people time to fill it out, and then. collect the results.
Unless we did a second
Probably.
meeting later in September.
Yeah, it's
yeah,
not,
you're right, you're right.
It's not gonna happen.
I'm not sure.
I mean, I think for September, we talked about, this is all the debate, I understand, but the other thing I think you've said for September is a priorities discussion, some initial presentation.
Yeah, of schools.
Oh, well,
Well, the conflict of interest, and we also, I don't know whether you wanna talk about or bring in somebody from the schools. Because you have, is it 3%? 3% of the funding has to go to schools.
there's two different conversations there. One is what is the Department of Education doing already on opioid abatement, if anything? I say that only because I just don't know. And then there's separately the piece, the council, if you read the MOU with the school districts, the council has an obligation to use a expert to help distribute those funds. Where that expert is from is not specified. So it could be DOE, it could be from the school districts, it could be a third party.
So
But there's two, I just wanted to disaggregate those.
the September meeting will be the conflict of interest policy. Updates from the governance committee, the finance committee, and the program grants committee. Then we'll talk about the survey at that meeting, what's the process of the survey and how's the survey going? And then if you want, does it make sense that we invite the Commissioner of Education, the Department of Education, in to discuss where are they and where's their understanding in regards to the funding? Yes, no,
In September?
yeah,
No, absolutely.
Or the different agencies.
okay,
Well, for one thing, then, I mean, yes, we have a specific provision regarding it in Department of Education, but each department has a number of opioid things. So, anyway, I don't want to say more about it. I just don't think that we'd be ready in September to have, nor would the Department of Education
Be ready.
to present us anything meaningful at that time,
Okay. All right,
later.
Between now and September, we can probably lay out a plan to hear a presentation at every council meeting for 20 minutes or something.
Yeah.
And then we can just lay out a schedule so we can large
Okay.
agency through here, municipalities or whomever else we want to hear. We just need to put it out, put it in
Okay.
place and get that done.
we can do that. And again, hey, heaven forbid, we only meet about an hour and a half, we get out of here, but I doubt that people, but we can try. All right, so. Always clear. On where we're going. Somewhat. It's an interesting conversation today. All right, so
It's not clear to me where we're going with the Department of Health. The DHHS with their recommendation.
that is going to the Grants and Program Committee. For discussion as to what a procedure would look like, and they'll bring that procedure back to the full council. At least that's my understanding.
Okay.
Yeah. So they will look at it, they'll look at some procedures, as you said, you didn't want it to go out without procedures, so they'll look at those parallel tracks as to what we need to do to move forward. Okay,
Is the next meeting September 14th?
it is. I have one more thing before everybody goes.
You gotta give it a big project.
Hmm?
You really need to do that project description.
Yeah, the job description.
It'd be really helpful to have a person on.
Yeah.
Line.
a survey.
Right now, to help you
Right now,
survey.
so I sent out the last job description. Is that job description an approval for everybody? And I can start the process of sending that out.
If we add the salary range to it, then yes.
The salary range will be there.
Right, and where is going out? Where does that mean?
So we actually already had candidates, one that's amazing to me, but that you all haven't seen it. So it will go out, because I don't want to make it public. So it will go out. I'll make a list and send people. It will go out to the nonprofit association. We'll post it. We can post it with the Alliance. We can post it on
Our website.
our website, we'll post it on our website. I don't know where the state applies, puts their jobs, because it's not a state employee's job. That needs to be clear. They're not a state employee.
Yeah, I just think it needs to be widely and readily available to the public and everybody should have an opportunity.
It will be widely, we'll put it we'll put it in employment, state employment, wherever we can. I'll consult an HR person and say, where do you put jobs? And we'll do it.
And then what's the process after that?
The process after applications will go in, we will, once they start to come in, we'll, I guess, look at the applications, and have a subcommittee look at the applications, prioritize them, and bring the top 3 candidates to the group. Todd,
Do you need a motion on the job description or you all set?
I don't think it needs a motion, unless you want to,
No, I.
as long as you all agree on
I
it.
want to get bogged down in procedure
Oh, no.
Is there,
later on.
is there a way to call an executive committee like an executive meeting? Because I feel.
Oh, well, you can vote to say that the applications will be reviewed by the executive committee.
Yeah, I just feel like.
And they will take their priorities and submit them, and make recommendations to the full
Is that a
council.
private meeting though? Because I don't want to put forward people, there's no way for this.
Can you
committee
look that
to
up?
have
This
a
is,
private
these are
meeting.
people's
So-
job applications, and
That
I'm,
doesn't
Oh,
feel
I
good
see. I know.
publicly.
yeah.
Yeah, that's what I'm.
Because I could be applying for a job and I got another job someplace else.
Executive session, yeah.
That's-
Executive
yeah.
session, that was
Yes.
the word I
There
was
is a
looking for.
committee called the executive.
Right, is there a way to call an executive session like at?
There is,
city
I'll look
council?
at the statute.
Yeah, okay. Well, I'll send the process to you all to look at. Okay.
We're gonna get there, Pat, I'm sorry.
I know.
In the meantime, Pat, will you be sending out that job description to get applicants?
Yeah, the one that you got, that I date now, because there's so many of them. It's
Well, they did
dated yesterday, I
This
think.
week, next week, today? You're gonna send that out today, Pat?
sent it out yesterday, I think. I think I sent it out yesterday. Yes, I asked Haley, please help me.
No,
I
I
said-
meant post it,
Huh?
post it yesterday.
I'm gonna post it as soon as I can, yeah. All right,
We're spiraling, sorry.
all right,
Too much.
But I think there's.
There was-
all right, where are we? Are we all set? All right. Thank you all. Great conversation. I'm putting this meeting adjourned. Thank you all on Zoom. Thank you very much. Thank you, public, for attending. And we're all